Have you ever wondered how a nasal gastric tube is inserted? Well, today we delve into the details of this vital medical procedure that is often performed in hospitals worldwide. First and foremost, a healthcare professional begins by washing their hands thoroughly. This simple step is essential in preventing the spread of germs and maintaining a sterile environment. Following that, the right size of the nasal gastric tube is selected. The length of the tube to be inserted is determined by measuring from the patient's earlobe to the tip of their nose, then down to their xiphoid process, which is the lower part of the sternum. A marker is placed on the tube at this point to guide the depth of insertion. Before the tube is inserted, the healthcare professional lubricates the end of the tube with a water-soluble lubricant. This makes the process smoother and more comfortable for the patient. Next, the patient is positioned correctly. Ideally, they should be sitting upright to allow gravity to assist in the tube's passage down the esophagus. Once the patient is comfortable, the healthcare professional begins to insert the tube, starting at the nostril and progressing towards the back of the throat. The patient is asked to swallow as the tube is inserted. This assists in guiding the tube down into the esophagus and ultimately to the stomach. After the tube is inserted to the marked depth, it is secured in place, often taped to the patient's cheek. It is then checked for correct placement. This is usually done by aspirating stomach contents and testing the pH, or by a chest X-ray. Lastly, once confirmed, the tube is connected to the necessary equipment, such as a feeding pump or syringe, and its functions can begin. To summarize, the insertion of a nasal gastric tube involves several steps. 1. Hand washing. While the process might seem complex, with practice and understanding, it becomes a routine part of patient care. This procedure, though simple, can significantly impact a patient's recovery or treatment plan, highlighting the importance of proper technique and understanding. That's it for today's topic. Stay tuned for more exciting and informative discussions on various medical procedures and topics. Remember, understanding these procedures helps demystify the world of medicine. Until next time, goodbye and stay healthy.